Hello, welcome to the Dr. Koob YouTube channel. In today's societies, given the fast-paced lifestyle we all have, the frequent consumption of fast food, constant stress, and a lack of physical activity, the likelihood of developing cardiovascular diseases has also steadily increased. On the other hand, a significant reduction in physical activity and a sedentary lifestyle can also substantially postpone the timely diagnosis of these diseases, leaving many people unaware of the underlying nature of their health problems. The risk of developing cardiovascular diseases tends to increase with age, and therefore everyone, upon reaching middle age, should prioritize having regular medical checkups for the early detection of these conditions. However, every individual is capable of performing certain simple assessments even in the comfort of their own home, to gain a relatively comprehensive understanding of the overall health of their cardiovascular system. In this video, we want to demonstrate several practical and effective methods so you can be fairly confident about your health at home. The first assessment item on our list is a detailed self-assessment for blood circulation disorders in the legs. You may experience persistent pain in your legs while walking, but you may not know if this is due to a blood circulation disorder or issues related to your muscles and bones. To detect potential circulation disorders in your legs, you should lie down on a flat surface and raise your legs into the air, holding them there for 30 seconds to observe the results. If the color of your foot becomes white or pale, it may indicate a significant blood circulation disorder in the legs. If the blood circulation disorder has progressed to an advanced and severe stage, you should also pay close attention to the color of your feet in their normal state. Sometimes blood circulation is problematic in only one leg, so comparing the specific color and overall condition of both legs can help in diagnosing a potential circulation disorder. A chronic blood circulation disorder in one leg can often present as noticeable hair loss, unusually shiny skin, distinct paleness, and a much greater feeling of coldness when compared directly to the other leg. If it is possible for you to measure the pulse, you will find that the pulse in the affected limb will also be significantly weaker. In general, any limb affected by a serious blood circulation disorder is much more sensitive to cold temperatures. If you haven't subscribed to our health channel yet, please hit the subscribe button right now and follow our informative videos every single night at 10 p.m. with a brand new topic. To diagnose swelling in the feet, do what I'm about to tell you. Gently press your index finger against your ankles. Your feet should remain relaxed in a lying down position. When you press on your ankle, a dent will form. If the dent is mild, it is usually not a problem. But if it is deeper than normal and takes a significantly longer time to return to its original state, that is abnormal and could indicate heart failure. The next point is self-assessment for blood circulation disorders in the hands. Just as we could assess and monitor for circulatory disorders in the feet, we can also evaluate the condition of the patient's hands. In this specific method, we need to accurately measure the patient's pulse rate. If the pulse in one hand is weaker than the other, it could indicate a circulatory disorder in that limb. Another step is to press on the base of the nail. Naturally, when you press on the base of the nail, the area will typically turn pale. But it is generally expected that after releasing the pressure, the nail color will promptly return to normal within 2 seconds. However, if it takes more than 2 seconds for the nail to regain its natural color, it is likely that there is a problem with blood circulation to your finger. Exposing the hands to cold can also help in diagnosing specific circulatory disorders. Obviously, if your hand has proper and adequate blood circulation, exposure to cold will only cause a slight change in skin color, which will very quickly return to its natural normal state. This paleness is not very noticeable, and you should not expect any significant or dramatic change in color. If you submerge your hand in cold water and experience abnormal whitening or bluish discoloration of your fingers, this is abnormal and indicates a circulatory disorder. Circulatory health problems may be caused by the narrowing of your blood vessels, or the vessel may be susceptible to spasms due to cold temperatures. I have explained several ways to open up the vessels in a separate video on this channel. You can refer back to that video for details. The link is also in the description of this video. Another method for home checkups for heart diseases is examining the nails. This part is very important. Please pay close attention. Bring the index fingernails together so that they are completely touching each other. In this position, there should not be a large gap between the nails if the fingernails become concave and spoon-shaped, and there is a noticeable gap when they are placed side by side, it is a significant clinical sign of cardiovascular diseases. It shows that oxygen is not reaching the extremities well. By extremities, we mean the fingers and toes. The next method is self-assessment of your heart rate. To ensure your heart rate is healthy and normal, you can manually measure and count your own pulse. A normal resting heart rate in an adult is typically between 60 and 100 beats per minute. If the heart rate is found to be less than 60 or more than 100, it is considered abnormal and should be checked by a doctor. Of course, in athletes, we sometimes see that this number can be as low as 50 and still be considered normal. When assessing heart rate, we should also check whether the intervals between beats are regular or not. An irregular heartbeat indicates whether you have a cardiac arrhythmia or not. In other words, is your heart generating beats properly or not? And if the pulse in both limbs, like the hands, is not symmetrical, that's not normal and could be a warning sign of disease. If you haven't liked this clip yet, please hit the like button right now so the video can reach more people. We can even monitor at home how the body's other internal organs affect the heart. For example, thyroid problems are accompanied by heart palpitations. To effectively detect this issue, hold your hands out in front of your body, close together but not touching. Carefully check for any signs of hand tremors. If your fingers are trembling, it could indicate an overactive thyroid, and your heart palpitations might be due to this condition. Of course, an underactive thyroid also affects heart health. The condition known as hypothyroidism may often be accompanied by hair loss on the outer part of the eyebrows, dry and rough skin, constant drowsiness and facial swelling. Furthermore, hypothyroidism can lead to high blood pressure, a significantly slower heart rate, and overall damage to your cardiovascular health. You can also self-assess for shortness of breath and general heart health at home to monitor these specific symptoms. If you experience the simultaneous occurrence of bluish discoloration of your nails, lips, and tongue, it may be a clear sign of low blood oxygen levels due to underlying cardiovascular issues, which should be thoroughly examined and evaluated by a doctor. Shortness of breath is one of the most common complaints among patients visiting cardiologists. If an individual experiences shortness of breath with even the slightest physical exertion, it is wise to consider possibility of cardiovascular disease. Of course, this symptom is not necessarily due to heart problems, and various factors can contribute to shortness of breath. The most important and common cause of shortness of breath in today's modern societies can be considered a lack of physical activity, which leads to what is commonly called a lazy heart and lungs. However, if you have recently developed shortness of breath and experience it even with the slightest activity, and your lips also turn blue along with the shortness of breath, you need to take the situation seriously and consult a doctor. Thank you for staying with me until the end of this video. Questions? Comment below and I'll respond. May God protect you.